To you by We're here on your hometown radio station, WPKY, The Tiger, at 8:05. And big day today out at Health First Community Health Centers on South Jefferson Street, as it is open house day, ribbon cutting. They have refreshments. They have free screenings, and they have building tours, and that all gets underway at 11 o'clock. And we have the pleasure of welcoming into the WPKY studios this morning Jenna Jerger and Rebecca Boyd. And good morning to both of you all.
Good morning.
All right, it's nice to have you. And Jenna, you are the marketing director. I don't know if that's your official title.
Yes, at Health First.
At Health First. And Rebecca, tell us your title.
I'm the outreach specialist.
Outreach specialist.
Yes.
Okay, and we'll get to what that exactly that is here in just a moment. But both of you all welcome.
Thank you.
And we're excited to have you this morning. We're excited to have you in town because today's a big day out at Health First. Tell us about it.
Yes, it is. We are having a ribbon cutting and open house at our Princeton location. It's located at 1100 South Jefferson Street. We have a lot planned today. We are actually having a live remote with WPKY,
Yes.
so we're super excited about that. The Chamber of Commerce will be coming out to do a ribbon cutting with us. Around 11:15 is when we will do that ribbon cutting. So if you want to make sure that you get there in time for that, be there around that time. We also will be doing health screenings, offering a tour of our building. We have made several updates to the facility, so we want to make sure to show that off as well. Rebecca here will have a booth set up with resources, information that would be great for you to pick up, educational information about different healthcare services that we provide, and she'll have all kinds of goodies. So you want to make sure you stop by her booth and pick up some of the little goodies, freebies. We'll have several door prizes that you can enter for as well.
Yeah, it's going to be quite festive. I'm looking forward to being out there, and I'm going to go out there and load up on a bunch of cookies and brownies. Then I'm going to get my sugar tested.
That's right. That's right. Yes.
No, I'm not. I'm not going to do that. I figure there'd be somebody pricking fingers out there or something. I don't know.
Yes.
I'm staying away from that stuff.
We've got several cookie platters coming.
I figured we would, see, but that's the fun of it. You know, you go out there and you load up on all the good sugar and stuff, and then they prick your finger and they tell you, you got some issues there, buddy. You know, but that's fun. But in all seriousness, though, this is a full-service clinic that we have here in town. We have an MD, Dr. Jamie Perry.
Yes.
Correct. We have nurse practitioners. We have outreach therapists and all kinds of, we've got dietitians on staff. So this is a clinic that we have here in town that can meet the health needs of the community, and that's exactly in your title. So tell us a little bit about the Health First Community Health Centers. You are a 501c3 not-for-profit, federally qualified health center. And it was established, I think, around 2010.
Yes, that's correct.
I was coming through, and you're not just here in Princeton and Caldwell County. I was coming through McLean County yesterday, and there was a nice center right there on Main Street in McLean County. How many counties do you all serve?
We serve 5 counties,
Okay.
and we've got 7 locations. We have locations in Calhoun, Clay, Earlington, Henderson, Owensboro, here in Princeton, and in Providence.
Right, and like I said, you're visible in several of our communities here locally, and what a blessing it is to have here in Princeton, because you all serve the health needs of the community. Rebecca, tell us a bit more about what you do specifically at Health First Community Health Centers.
I'm the outreach specialist here
Okay.
here in Princeton, and we do have outreach specialists in the other locations also. And the biggest thing that I do is work with our sliding fee program.
Okay.
And and what that is the sliding fee program is based on your income and household size. And if you don't have insurance, or maybe you do have insurance, but you've got a high deductible, which so many of us have now.
Right.
That can help cover those copays or cover those deductibles. So maybe you might only have to pay $20 to come in and get those services covered.
So you would kind of evaluate the individual specific situation.
Yes.
As far as what their potential coverage and cost might be.
Exactly.
It's pretty complicated, isn't it, in today's medical world, depending on what kind of insurance you have, whether it's Medicare, Medicaid, and I mean, it just seems like it's a little too complicated sometimes.
It really is.
But you sort that out for everybody, don't you?
Yes, yes. And with prescriptions as well.
Okay.
We do offer a prescription program, and that can help with those copays as well, because our prescription program, you may only have to pay $5 for your prescriptions.
Okay.
If you qualify for that.
So when you come into Health First Community Health Center, you're going to be one of the faces that folks see to kind of talk about what their billing might be like.
Right,
Okay.
right, yes. If you need assistance, you just be sure to let the receptionist know that you need the assistance, and I'll be more than glad to talk to you.
That's fantastic. Jenna, let's talk about the many services that you all provide for your communities that you serve. We have lots of things from primary care, behavioral health, women's health, prenatal care, pediatrics, dermatology, nutritional counseling, diabetic eye screenings. A lot of people don't realize that the eye can tell a lot about your health. When you go to the optometrist, they can see things to refer you to a clinic or a physician. You've got laboratory there, X-ray, medication management therapy. That's interesting. We'll get into that. Prescription programs, as you just mentioned, case management, enabling outreach services as well. So, boy, lots of things you all touch and are involved in. Tell us more about that and how the philosophy of, because it's a different type as we evolve more and more, and we talked about the complications of health care. It's these clinics like yours that are really becoming more of a trend in medicine now, and the taking care of patients' needs than maybe just going to a general practitioner, family physician.
Yes, our goal is to treat the overall needs of the patient. So with that being said, we've got several different services that we offer so that our team of healthcare providers can work together for the overall best needs of that patient. We don't have all of these services at every location, but you can always go to any of our clinics if you are in need of those services. We have diabetic eye screenings, as you mentioned, and Dr. Adria Porter comes to our Providence location and does those eye screenings. We want to make sure we take care of our diabetics, so that is one of the major things that we encourage is those eye screenings, as well as looking at the diabetic's feet and doing regular blood checks, checking their A1Cs, and just making sure that we keep that person healthy.
Yeah, and we know medicine works well when it's a holistic approach. Nursing and physicians are based on that. Let's talk about your qualified staff that you have here in Princeton. Of course, Dr. Jamie Perry is the ND, anchoring the staff there. What other staff do you have out at Health First Community Health Clinic?
We have Chelsea Akins, and she is a nurse practitioner, family practice. We have Amanda Ort. She's a licensed professional clinical counselor. And we also have Allison Choate, and she's a registered and licensed dietitian, and she's also our diabetes educator.
Okay, yeah, I think Allison has been on the program before and did a diabetic when you were having your free diabetic classes here in the area. So those were fantastic. And what a service that was for the community. These were classes that were free for diabetics, someone that may be a pre-diabetic, but it was about diet, it was about insulin dependence, it was about type 2 diabetes, so there was an education class right there. And it seems that the Health First Community Health Clinic's philosophy as being a non-for-profit type of provider is to educate and is to help in the preventive aspect of illness.
Yes, that's correct. And we plan to offer those diabetic classes on a regular basis. We are trying to extend those out to all of our clinics. So maybe if you have heard of those classes and you wanted to attend, but you just couldn't make it work with your schedule this past class, keep looking on our Facebook page or our website for upcoming classes, because we will be doing those regularly.
Okay, well, good deal. It is just about 15 minutes past the hour. Let's take a short break, and we'll come back and talk more. We have Jenna Jerger. She is marketing director and of community health service of health centers here in Princeton, Health First Community Health Center, and we have Rebecca Boyd here. And we're going to be talking more about services they offer. And, of course, it's a big day out there. It is open house and ribbon cutting day. They're going to have refreshments, free screenings, a tour of the building. They've done a lot of updates. And those of you, it's out on South Jefferson Street. For those of you, Jenna gave the address, but it's the Dr. Settle's old clinic and Dr. Mike Littlejohn's clinic. Dr. Jamie Perry and Health First Community Health Centers are there now, but that's the clinic that we're referring to, and that's going to be today. They're going to be doing that between 11 and 1 o'clock, and they want you to come out and check out all the good stuff going on at Health First Community Health Centers here in Princeton. We're going to take a quick break here on Tiger Talk. We'll be back on your hometown radio station, WPKY The Tiger. Hancock's Neighborhood Market on Commerce Street in Cadiz is the place to shop for delicious homemade goodness. Hancock's makes their own fresh chicken salad, pimento cheese, salads, and a variety of mouth-watering desserts sure to please your entire family. While at Hancock's, be sure to visit their meat department for the best selection of USDA choice meats in the area. Hancock's Neighborhood Market in Cadiz, hometown, homemade goodness, and the Hancock name you know and trust for quality for your family. Hancock's Neighborhood Market on Commerce Street in Cadiz.
Since 1978, Perry's Floors and More has been selling, installing, and servicing homeowners throughout Western Kentucky with quality flooring and workmanship. Perry's Floors and More carries luxury vinyl plank and luxury vinyl tile, carpet, window treatments, and more. Quality brands like Mannington, Shaw, Tarkett, Beaulieu, and Flexitech. There is a reason why we say you can walk on our reputation. Come see Bill and Lucy at 127 West Market Street or call 270-365-9869.
And we are back on Tiger Talk at 8:16 with Jenna Jerger and Rebecca Boyd of Health First Community Health Centers in Princeton. Their open house today between 11 and 1. WPKY is going to be out there about 11 o'clock and walking around being silly but having a good time and trying to get folks out there to check it out, what they've got going on. And Jenna, let's start. And let me just ask you, what is a community health center? It's in your name, and it seems like these types of centers are popping up. And, you know, healthcare is confusing for a lot of folks. It can be. Sometimes it's not. They just know they have one person that they like to go to, and they just go. But tell us about what a community health center is.
Well, community health centers were established back in 1965, and the goal was to address the healthcare barriers that existed for people that lived in rural areas or people that lived in poverty. These people needed care, and they just were not able to get that care. So since then, there have been actually 1,400 health centers established across the United States with more than 11,000 delivery sites. And they serve more than 25 million Americans every year, which statistics are very interesting for that. That's 1 in 10 kids, 1 in 6 Americans living in rural areas, and 1 in 3 Americans living in poverty. But what a community health center is, we're a nonprofit, we're community-based organizations, and we provide primary care services to individuals that are in what is called a medically underserved area. And how that's determined, there is something called a UDS mapper that we look at, and it shows areas that there is a need for health care. So that's generally what we look for when we're trying to find areas to go into where there's a need, where we can help individuals in the community and make sure that they get the care that they need. Another thing that is unique to a community health center is that we're governed by a board of directors, and they must make up 51% of our 51% of that board of directors has to be clinic users, and the other 49% can be community members and leaders with various backgrounds, maybe in banking, finance, other areas that are beneficial to the health center. And with that 51% clinic user representation on our board of directors, our patients are the ones making the decisions for the health center. So they are making sure that our health centers are unique to the patients in that community and that we're serving that overall need.
You know, that's an interesting concept, and one that seems to be working and catching, trending across the country. Now, we were talking to Rebecca here about the eligibility. I mean, can just anybody come in and use the clinic, or are there certain qualifications? Are there people that you say, well, you don't qualify because you're a nonprofit and you have private insurance, or how does all that work?
Yeah, anybody can come in and be a patient at Health First.
Okay.
Now, as far as qualifying for sliding scale and those different services, that is determined on your household size, your income.
Okay.
You know, we do have other programs that you would qualify for, other prescription programs that you might qualify for if you need help in different ways. But as far as just being a patient, anybody can be a patient.
Yeah, whether you got insurance, you don't have insurance, or
Correct.
whatever how you pay. Okay.
Yes, and some people are under the impression that because we are able to help patients with no insurance, that if they have insurance that they can't come to us, and that's just not right. We serve everybody, regardless if you're insured, underinsured, or uninsured, just like you said.
Well, that's important to get out there, because a lot of people say, well, I can't go out there because I've got insurance, or I don't have insurance. They're not going to serve me. So that's good. Anybody, if that's where you choose to go get your health care, can go out there.
Yes, right. and you may be very surprised, but if you have insurance, you still may qualify for some of our programs.
Right, and that's what I was getting to next. It's, as we mentioned, your job in a way is pretty complicated, because it really depends on each family individual as to how you determined payment for services and what gets covered, isn't it?
Yes. Every situation's different.
Okay. Do you all have a website? Are there places that people can go on and look at things about you all in the areas?
Yes, our website is healthfirstchc.net, and we encourage you to visit that. There's a lot of great information. There's actually information about our sliding fee discount program, so if you would like to learn more about that or see the qualifications, all that information is actually listed on that website. So we have 4 classes, Class A through D, and that is determined based on the federal poverty guidelines, and each class determines how much you would pay to be able to see a provider at our facility. So it could be up from, as Rebecca said, as low as $20 all the way up to $75 according to those slides. But we've got all our locations listed, all our providers. There's bios on our providers. If you're going to be a new patient, there's our new patient paperwork, so we encourage you to visit that website. We also have a Facebook page, so if you want to stay up to date on things that are happening within the health center, be sure to go and like our Facebook page so you can keep up with those.
And, of course, you all have 7 locations across West Kentucky. You serve the communities, and you said each community is different. You have a board. Do you have a board of directors for the entire 7, or is there a board for each individual, or is it one main board that's the board for all 7 communities?
We have one board of directors for all of our clinics. Currently, we have 11 board members, and our goal is to have a representative from each county that we serve to be able to help make decisions in the best interest of that health center in that area. We do need some representation from Caldwell County. So if there's anybody out there
There you
that
go.
would be interested in serving your community and serving the needs of our health center patients, please give us a call, or actually there's some information on our website that you can check out as well.
Yeah, it's interesting. If you are out there listening, do consider, because you'd be a vital part, a voice for patients here in our local area that use community healthcare centers and maybe other medical offices and places as well. Let's talk a little bit about the primary care services in rural areas. You mentioned that earlier. As far as the qualifications and how these community medical centers popped up, this is comprehensive primary medical care. This is for, you can show up there with really whatever ails you, and if you cannot do it out there, or cannot serve, you will get them somewhere to get, if they needed a specialist or whatever, they would be referred somewhere else. Is that correct?
That's correct.
Yeah.
And we are what's called a patient-centered medical home, which means that we have a team of healthcare providers that collaborate and work together for the best overall healthcare needs of that patient. And if you're seeing one of our providers and they feel that you need to go to a specialist, we actually have a referral department that can help set that up. So that takes the burden off that patient to have to call the office. If they cannot reach somebody, keep calling until they can get an appointment. So our referral department helps with that. And then also after the appointment, our referral team will get the medical notes and send those back to our providers so that they have those for when the patient comes back. They can look at the overall needs for that patient and make sure that everything is being taken care of.
Right, because a lot of folks, they know they might be sick or they don't know what's going on, and it can be a scary time. A lot of unknown, a lot of fear, and I think that it's nice to be able to walk into a community health center where you see, most of the people out there are local. You see the local faces that you trust. They're qualified. They have the credentials, and it's nice to be able to sit down one-on-one with them. And if there is a referral that's needed or there's a medical situation, they can talk to someone that they know that's qualified to talk to them about it, and then maybe get the trust to know that if they have to go on somewhere else, that they're confident that will be a need that's taken care of. So,
and as a medical home, it is a partnership in care between the patient and our provider. And we are community partners with various entities such as pharmacies, hospitals, diagnostic centers, other healthcare entities. So we work as partners with those healthcare entities to make sure that patient gets the best care.
Whether it's an MRI or something like that
Yes.
they need, they're referred. Okay. Well, that's awesome. So more than 1,400 community health centers across America. And how long has this concept been in place? Is this something new, or is this something that you said earlier? I think you said since what year was it?
1965.
Yeah. See, and that's it's funny. This concept. Is it just now getting her? Have there been other models here in West Kentucky that have been here? Because this seems a little bit different on how you all approach and how the community health center is. Or has it been since healthcare in America has been sort of tossed up and down, and and kind of turned on in, and it's just confusing for a lot of people.
Yeah.
And it just seems like it's. I don't know what the solution is to it. It just seems like still it's harder than it has to be, I guess. But you all seem to kind of take the complicated and simplify it,
Right.
and let people focus on their health, and that's a good thing.
And then we've got great staff members like Rebecca that can help coordinate that care. If a patient has questions, doesn't know how to access something or has a need, those outreach specialists are there to help that patient one-on-one.
Right. And tell us a little bit more then about some of the philosophies and some of the things that set community health centers apart from other places that you might go to the doctor.
Well, we see everyone. We don't deny patients based on ability to pay, insurance status, age, sex, religion, or race. We see everyone. And then we've got the special programs that we offer that's unique to a health center, such as the sliding fee discount, prescription assistance programs, and the coordination of care.
Okay. And you say prescription assistance programs, but most people say, well, I like the pharmacist where I go. For the most part, they can stay with whatever pharmacy that they're comfortable with. Is that correct for the most part? I know sometimes drugs, may not, availability and that kind of thing may so, but tell us a little about people that might be listening that are a little bit nervous about maybe using your services and staying with a certain pharmacy that they like.
Well, we want our patients to go to their pharmacy of choice. So we would not push a patient to go to a pharmacy that they did not want to go to. We do have certain pharmacy partners, though. So
okay.
In order to get some eligible for some of the discount programs, they would need to go to one of our community partners.
I guess that's what I was getting at. There might be a certain partnership with a pharmacy that would allow them to save on drugs or whatever prescription medications, whether it was a generic or a name brand type thing.
Correct. And then we've also got programs that we can work with certain pharmaceutical companies directly to help the patients get discounts or free prescriptions through, and that's what our outreach person will be able to do, is sit down with that person and figure out which program would be best for them and help them get that savings.
Awesome.
Here in Princeton, our 340B program that our sliding fee patients
Right.
are eligible for discounted prescriptions, and Princeton Drug is who our partner is with,
Okay.
and they're wonderful to help our patients.
Okay.
So shout out to them.
Okay, good deal.
They are very helpful with that coordination, and I've had to call on them many times
Okay.
to help the patients, and they're great partners. And in the other communities, I wouldn't even begin to be able to name those other pharmacies
Right.
that are 340B partners, but I know there are many in the other communities as well. But in Princeton right now, they're our only pharmacy that we partner with.
Well, back in my youth, I worked at a pharmacy, a small town local pharmacy, and kind of as a farm tech, and I know how particular people can be about their local pharmacists and the medications that they take. A lot of folks just know it's this red pill for this, it's this white pill for this, it's this blue pill for this, and this is my heart pill, this is my blood pill, this is my sugar pill, and it's one of those things that when you don't know the chemistry behind what you're taking and all that stuff, it's confusing, and there's a certain comfort level with some pharmacists that they trust, and it's just the same way with a medical provider and who they see. But as we mentioned before, you have a very qualified, very hometown, very comforting staff out there at Health First Community Health Centers that if someone locally goes out there, they're going to see a smile and a friendly face, and that's a big plus.
Yes, and going back to the prescriptions, and as part of our medical home, we have a pharmacist on staff that can review patients' records and determine if they are on the best medications for them. So if they have went to other specialists outside of our health center and are seeing one of our providers, and maybe the combination of prescriptions that they are on is not the best for the patient, our pharmacist would be able to do some medication management with that patient and determine which medications would be the best for them.
Okay. Well, that's good. That's a good deal. We're about 32 minutes in.
Wow.
It didn't take very long, does it? They
Well,
were
better than I was expecting.
Well, we're going to talk some more about this because we've got some wonderful happenings today out at Health First Community Health Centers. We've got an open house and a ribbon cutting. You guys have been around for a while and just kind of getting around to this. It's not like you set up shop 2 weeks ago. You've been around for a while. Tell us when the clinic opened up here in Princeton.
Well, actually, our clinic opened last July, and at that time, we just were not able to do the ribbon cutting. So we are doing it this July to celebrate 1 year of service to the community.
Yeah, it's going to be a fun day. it's a busy day around WPKY on Thursdays, but we're going to head out there and be on site 11 o'clock hour and run around and hopefully talk to a few folks and be on hand for the ribbon cutting, the refreshments, and all the goodies, and just a good time. We want to encourage everyone, 11 to 1 today, to head out to the Health First Community Health Clinic on South Jefferson Street. That's Dr. Settles, the old Dr. Settles Clinic, and Dr. Littlejohn Clinic, and that's where Health First Community Health Center. What's the address again, Jenna?
1100 South Jefferson
That's easy.
Street.
Yeah, that's 1100 South Jefferson. Yeah, you gave the address, but everybody knows that as the Settle Clinic or the Littlejohn Clinic out there. But now it is Health First Community Health Center of Princeton. Dr. Jamie Perry and a wonderful staff out there. We'll come back and talk more about the staff again and some of the great happenings that are going to go on out there today, and do a little wrap up here as we've got a few more minutes to talk to Jenna, Jerger, and Rebecca Boyd from Health First Community Health Centers here in Princeton on Tiger Talk at 8:34. We'll be back in just a moment. You're listening to Tiger Talk on your hometown radio station, WPKY The Tiger. Hancock's Neighborhood Market on Commerce Street in Cadiz is the place to shop for delicious homemade goodness. Hancock's makes their own fresh chicken salad, pimento cheese, salads, and a variety of mouth-watering desserts sure to please your entire family. While at Hancock's, be sure to visit their meat department for the best selection of USDA choice meats in the area. Hancock's Neighborhood Market in Cadiz, hometown, homemade goodness, and the Hancock name you know and trust for quality for your family. Hancock's Neighborhood Market on Commerce Street in Cadiz.
Since 1978, Perry's Floors and More has been selling, installing, and servicing homeowners throughout Western Kentucky with quality flooring and workmanship. Perry's Floors and More carries luxury vinyl plank and luxury vinyl tile, carpet, window treatments, and more. Quality brands like Mannington, Shaw, Tarkett, Beaulieu, and Flexitech. There is a reason why we say you can walk on our reputation. Come see Bill and Lucy at 127 West Market Street or call 270-365-9869.
And we're back on Tiger Talk at 8:35. Jenna Jerger and Rebecca Boyd from Health First Community Health Centers here in Princeton. It is a ribbon cutting open house today, and that's at 1100 South Jefferson Street, the Settle Littlejohn Clinic, formerly, and now it's Health First Community Health Centers. And Jenna, 11 o'clock is the time. Ribbon cutting about 11:15. The Princeton Caldwell County Chamber of Commerce be out there with their big scissors, and we're going to cut a ribbon. And tell us maybe some of the folks that will be out there from community health centers, and then we'll talk a little bit more about the center itself and invite everybody out to come have a good time with us.
Okay. We will have our providers there, Dr. Jamie Perry, Chelsea Akins, Amanda Ort, Allison Choate, and several of our administration staff will be on hand as well. So if you would like to come out and meet some of our staff members, this will be the great time to do it. Come out and meet Rebecca with our outreach team, our nurses, our receptionist. We've got a great team of people there.
There's a great staff out there. In fact, some of them communicate daily. They listen to the Tiger out there. We certainly appreciate that, and we have a good time. Yeah, go ahead.
Let me give a shout out to everybody that works out there.
Yeah, let's do that. Yeah, they're listening probably.
Yeah, we've got Janice Perry is the RN out there, and we have Marissa Bragg.
Oh my goodness!
We have
Sorry
Kelly
about
Harper. She's in the quality department, but she works out there as well every day. Let me see. We have trying to go around the building here. I don't want to leave anybody out. Mandy Phelps. She is Chelsea's nurse.
Yeah.
Julie Bell's the receptionist. Am I leaving anybody out? I sure hope not, because I never forget myself. I think that's everybody.
Okay.
We do have a good team, so come on out and meet everybody, and I hope to see the whole town there.
Okay, tell us about some of this. I saw on the flyer that you're going to be doing screenings. There'll be some screenings going on out there?
Yes, we'll be doing blood pressure and blood sugar screenings.
All right.
And then, of course, we've got lunch. You can't miss lunch.
Wow, that's going to be good. I hope there's like a plate of cookies. Like I said, I'm actually going to stay away from any of the finger sticks or needles or blood pressure cuffs or anything like that. I'm just going to go out there and act silly and have a good time and invite people out.
That's right.
But I thought it'd be fun to eat a bunch of cookies and wait a half hour and then get my fingers stuck.
That's okay. And then we'll get you an appointment with Allison, our dietitian.
Yeah, and I've talked to her about that. I'm working on that. So, but yeah, it's going to be a fun. It's going to be a fun afternoon. That's from 11 to 1, and of course, Princeton-Caldwell County Chamber of Commerce will be out there cutting the ribbon. And let's talk a little about the clinic itself. Let's talk about the hours of the clinic. When can you're taking new patients as well?
Yes.
If you're out there and you're listening and you're like, oh man, I hadn't been to the doctor for a while, or I don't have anybody that I go to. I'm confused about all this. What can I do? Then you guys are taking new patients. It's an easy process. Yes, there's some questions and some paperwork to fill out, but other than that, you guys will make them feel welcome and accept them. And tell us about the hours of the clinic.
We're open Monday through Friday, of course.
Mm-hmm.
Our hours are 8 to 5 most days.
Mm-hmm.
Now, on Wednesdays, we are open from 7 in the morning until 6 at night.
Okay.
And on Fridays, we're open from 8 to 3. So,
Okay.
but Wednesdays, we do have extended hours.
Extended hours. Kind of
Yes.
makes up for that Friday time where they might be a
Exactly.
little bit short.
Well,
but,
and that gives people a little bit more time to come in if they have to work during the day.
and in this day and age, usually on Friday by about 2 o'clock, everything's shutting down anyway. Everybody's getting out of town for the weekend or anything else. But those are good hours, and it can accommodate many schedules. And taking new patients, tell us how that might work. If somebody's out there going, man, I haven't been for a while, or what can they do?
They can call our office. The number is 365-9455, or we also have a toll-free number, 1-877-667-7017. And as I mentioned earlier, if you would like to go to our website, we have our new patient paperwork on our website. You can download that, fill it out, bring it in with you, save you some time.
That's convenient and nice. You can download all that pre-patient paperwork and have it right there. And again, if you're out there listening as well, don't be intimidated and think, well, I can't go there. I've got super whopping insurance, or I don't have any insurance. Let them take a look at what you have, because they're here to provide health care for the entire community, no matter what pay scale you're on. They have programs and can accept most major insurances and those kind of things. So don't let that intimidate you. Rebecca, is there anything that you want to let the listening audience know about either some of the things you do or some of the topics that we didn't talk about that you feel are important as far as community health centers, or just what you do out there?
I think we've pretty much covered everything.
Okay.
We do have a connector on staff. She helps with insurance, Medicaid insurance, getting people signed up for that.
Okay.
So she's in one of our other locations, but she can come to Princeton. So if that's something that you need assistance with,
Okay.
just give us a call and we can get that set up for you.
A connector.
A connector,
Okay.
yes.
Explain that terminology. That might be something I'm not familiar with that.
Yes.
in the health field.
A connector is,
Sounds like a dating site.
Yeah. I think that probably is a dating site, but yes. Yeah,
it's not that, I promise. But,
Yes,
okay.
yes. A connector is someone who assists people with getting signed up for Medicaid. That's become
Okay.
a very difficult process.
Oh, surely not. It's the government.
Yes, very, very difficult process. And it just seems to get more difficult as time
Why
goes on.
is that? I mean, why? Again, I go back to this, and I grew up around. My mom was a nurse. I've had nurses in my life. I've kind of grown up around healthcare. I've worked in a pharmacy. When I was a kid. I mean, why in the world is it so complicated? In some of the most in the scariest times of some people's lives, why do they make it so complicated? I mean, that's what's so cool about this clinic and these types of clinics are. I think you're kind of making the process easier, I would hope.
Right.
Or it doesn't allow the patient to have to think so much about that if they're sick.
Exactly.
And that's what's so great about this, I think.
Well, so many of our patients not just our patients, but just the population in general don't even have access to a computer.
Right.
And so just give us a call or stop in, and we'll just see what we can do to help you.
Well, that's fantastic, because I'm sure there are a lot of people out there that they don't know what to do.
Right.
And this connector, so to speak, that's a new terminology for me in the medical field, can help with that. So that's an awesome service that you all have. And, of course, the hours of Health First Community Health Clinics, flexible for most any schedules, and you are taking patients now from pediatrics all the way up. Is that correct?
Yes, we are.
Pediatrics to geriatrics.
Exactly. Yes.
Okay.
Yes.
That's fantastic.
Just give us our office a call, and we will get you an appointment.
Awesome. And, of course, as we wrap up this segment of Tiger Talk, head on out today to the ribbon cutting open house at Health First Community Health Centers. It's from 11 to 1. They're going to serve you lunch, and they might even prick your finger and check your blood pressure if you want them to do that. They're not going to force you to do that, but and they're going to give you a tour of the building. I'm excited to see what the building looks like, because I know you've made some improvements out there, and it'd be kind of cool to see. But work will go on as well, won't it?
Mm-hmm.
It's not like you're shutting down. If somebody comes in and they have a need, you guys will just be taking care of their needs as well while all this is going on.
Exactly.
So we encourage you to head out and meet the fine staff at Health First Community Health Centers today from 11 to 1. Open house, Princeton-Caldwell County Chamber of Commerce ribbon cutting around 11:15 or so, lunch and refreshments, and just a good time. And a lot of friendly, smiling faces and folks that you know that when you're sick, they will take good care of you.
Yes.
So that's the awesome thing. So thank you all so much. As we wrap up here, Jenna, is there anything else you'd like to tell the listening audience about Health First Community Health Centers? Did we miss anything?
We just hope we see everyone out today and come register for the door prizes.
Oh, they've got prizes too.
Mm-hmm.
I can't.
Got prizes too.
Awesome. It'll be a fun day at Health First Community Health Centers, 11 to 1. We'll be on hand for some of the fun as well in the 11 o'clock hour. Hope to be there for the ribbon cutting, and hopefully talk to a few folks and put them on the air. And we look forward to it. And thank you all so much for being here. And it's 11 to 1 at a Health First Community Health Centers, 1100 South Jefferson Street. That's the former Settle Little John Clinic. It is now Health First Community Health Centers. Check it out. Fantastic folks, quality health care for the entire community out there. And we hope to see you between 11 to 1. So, Jenna, Rebecca, thank you so much for being here today. And we'll see you in the 11 o'clock hour. And we'll celebrate Health First Community Health Centers 1 year here in Princeton and Caldwell County. Thank you all so much.
Thank you.
All right, that's going to wrap up this edition of Tiger Talk. Of course, it's Farmers Market Day down at the Farmers Market. They're there from 4 to 6 every Thursday, Saturday 8 to 12, and Tuesdays 11 to 1. Might have a few representatives pop in here from the Farmers Market on Thursday. They certainly have been. They have an invitation too, and we might see them in a few minutes. If they do, we will put them on the air and talk more about what's going on at our Caldwell County Farmers Market. They're down between East Main and East Market Streets, right in front of the Frank P. Janina Senior Citizens Center. That's where they're located. 846, thanks for joining us, and thanks to Jenna Jerger, Rebecca Boyd from Health First Community Health Centers. We'll see you at the 11 o'clock hour out there at 1100 South Jefferson Street here in Princeton. Have a good day, everybody.